Okay, so we have a few questions that had already been prepared just kind of based off of previous lectures. And the first one's going to be for Dr. Dewan. And, you looked at those guidelines that we had kind of already, that everybody had given their input on as to what we were doing in current practice. And as far as those go, what did you think was the most surprising finding from that questionnaire? And also, what would be the most useful change in the current guidelines after you've reviewed all of those practice patterns?
I think the most surprising was that the physician responded all over. There is no consistency. And I don't know whether everybody, those who responded very well, was kind of understood or just whatever their practice was. It sounded like, if you stop Plavix or somebody in some very heavy drug for prevention of stroke for a low risk procedure, doesn't make much sense to me. But there were people who were stopping that.